Prostate cancer, 10 early signs and symptoms. Don't ignore. Most men never see it coming until it's too late. By the time they notice, the cancer has already spread. But what if you could spot the early signs before it turns deadly? Prostate cancer is one of the most common and dangerous cancers in men. It's scary because it grows silently. You might feel fine today, you might even feel fine tomorrow, but hidden inside, dangerous changes could already be happening. The truth? About 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Every year, hundreds of thousands of men face a battle they never expected. And sadly, tens of thousands lose that battle. But it doesn't have to be this way. If caught early, prostate cancer is highly treatable. That's why today we're diving deep into the 10 early warning signs you must never ignore. Your life could depend on recognizing them. Stick around because some of these signs are surprising, and one of them happens in your sleep when you least expect it. Let's get started. 1. Painful or burning urination. Ever feel a sharp, burning pain when you pee? It's easy to blame it on something simple like dehydration or a minor infection, but when your prostate swells or gets invaded by cancer cells, it can squeeze your urethra, the tiny tube that carries urine out of your body. That pressure causes irritation, and that irritation causes pain. Sometimes, infections ride along with prostate problems too, making the burning even worse. If you're feeling pain when you urinate, especially if it happens again and again, don't brush it off, get it checked. Risk factors to watch: family history, being overweight, poor diet, and lack of exercise can all make symptoms worse. 2. Frequent nighttime urination, nocturia. Waking up once in a while at night is normal. But when you find yourself getting up 2, 3, 4 times every night to pee, that's a problem. The prostate sits right under the bladder. When it enlarges, it puts pressure on your bladder. That pressure tricks your body into thinking it's time to go, even when there's not much urine inside. If your nights are being interrupted and you're dragging through your days, pay attention. Frequent nighttime urination could be an early warning signal. Quick tip: keeping a bladder diary for a few days, noting how often you pee, can help your doctor diagnose the issue faster. 3. Blood in urine or semen hematuria. Seeing blood in your urine or semen can be terrifying. It's one of those symptoms you can't ignore, and you shouldn't. Cancer disrupts normal tissue. It can cause small blood vessels to break, leading to visible blood. Sometimes the blood is bright red, other times it's pinkish or even dark brown. Even if the blood seems to disappear after a day or two, get medical help right away. Microscopic blood may continue without you seeing it, and the underlying cause could still be serious. Important: don't assume it's a bladder infection or kidney stone without testing. Blood is a warning sign that demands action. 4. Persistent pain in the back, hips, or pelvis. Back pain is common, right? We all pull muscles, twist wrong, or sleep funny sometimes. But persistent, deep, aching pain in your lower back, hips, or pelvis could mean something far more serious. Prostate cancer often spreads to bones. When it does, it causes ongoing pain that doesn't go away with simple stretches or painkillers. It might feel like a dull, deep ache that's always lurking in the background. If you have back pain that's stubborn and unexplained, especially if it's getting worse, get it checked. Did you know? In men over 50, back pain is one of the first signs doctors look for when they suspect prostate cancer. 5. Difficulty starting or stopping urination. Picture this: you're standing at the toilet and nothing happens. You strain, you wait, you feel pressure, but the urine barely trickles out. This is a classic prostate problem. An enlarged prostate pinches the urethra, making it hard to start urinating. And once you start, stopping can also be difficult. You might feel like you're never fully emptying your bladder. Warning: if you're experiencing hesitation, a weak stream, or dribbling after urinating, your prostate could be in trouble. 6. Weak urine stream. Healthy urination should be a strong, steady stream. But if you notice that your stream has become weak, slow, or interrupted, pay attention. A weak flow often means there's a blockage, and that blockage could be caused by an enlarged or cancerous prostate. Extra clue: some men notice they have to push or strain to urinate. It's not supposed to be a workout. If you're working hard just to pee, it's time for a checkup. 7. Loss of bladder control. Incontinence, leaking urine accidentally, can be embarrassing, but it's also a huge red flag. When prostate cancer invades or damages the nerves that control your bladder, accidents happen. You might leak a little when you laugh, cough, or lift something heavy, or you might feel a sudden desperate need to go and not make it to the bathroom in time. Fact: up to 25% of men with prostate cancer experience some degree of bladder control issues, especially after surgery or radiation. Erectile dysfunction, ED. This one's tough to talk about, but it's important. Prostate cancer can affect the nerves and blood vessels responsible for erections. If you've noticed sudden or unexplained difficulties getting or keeping an erection, it's time to get evaluated. Good news: if caught early, prostate cancer treatments today are much better at preserving sexual function. Early action is key. 9. Painful ejaculation. Pain during or after ejaculation is not normal. Some men describe it as a sharp sting, others feel a dull ache deep inside the pelvis. Either way, painful ejaculation could mean that cancer is irritating sensitive tissues around the prostate. If intimacy is becoming painful instead of pleasurable, don't suffer in silence. Your body is trying to tell you something. 10. Sudden, unexplained weight loss. Losing weight without trying might sound great to some, but when your body starts shedding pounds without diet changes or exercise, it's a warning sign. Cancer cells burn a lot of energy. They can hijack your metabolism and cause rapid weight loss, along with fatigue and muscle loss. Look out for drop in appetite, feeling full quickly, constant tiredness, clothes feeling looser without trying. If the pounds are falling off and you don't know why, it's time to dig deeper. What causes prostate cancer? Doctors aren't 100% sure, but research shows it usually starts when normal cells begin to grow out of control. Instead of dying off like they should, these rogue cells multiply and form a tumor. Some tumors grow slowly, others are aggressive and spread fast. Genetics, lifestyle, diet, and even hormones play a role. Who steps most at risk? Age. Risk increases sharply after 50. Family history. Dad or brother had prostate cancer. Your risk doubles. Obesity, more body fat equals sign higher risk. Ethnicity. African American men face the highest risk. Can you prevent prostate cancer? There are no guarantees, but you can slash your risk by eating a healthy diet rich in fruits, vegetables, and whole grains, staying physically active, maintaining a healthy weight, talking with your doctor about your personal risk factors. Pro tip: some medications like finasteride can lower risk, but they come with side effects. Always talk to a doctor first. Prostate cancer can be a silent killer, but it doesn't have to be. Listen to your body. Respect the warning signs. Early detection can save your life, literally. If you notice any of these 10 signs, don't ignore them. Don't wait. Make an appointment with your doctor. One simple test could be the difference between life and death. Subscribe for more life-saving health tips.